and welcome to this public hearing of Columbus City Council's Health and Human Services Committee. I am Councilmember Priscilla Tyson and Chair of the Health and Human Services Committee. Before getting started, I want to make everyone aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is www.columbus.gov. The topic of this afternoon's hearing is Minority Health Month, which occurs in April. Minority Health Month allows us to highlight and discuss the health disparities among particular groups of residents in our community, the services available to these groups, and the city's ongoing efforts to address these disparities and to enhance overall health equity in the city of Columbus. Before we begin, I'd like to explain to our viewing audience the origins of Minority Health Month and why it has become such a critical time for our community. It was created in April of 1989. Minority Health Month is an annual campaign which focuses on health awareness and disease prevention in minority communities. In short, 5 goals of Minority Health Month are to provide critical information for individuals to practice disease prevention, to promote healthy and active lifestyles, to showcase the resources for and providers of grassroots healthcare information, and to bring attention to the desperate health conditions between Ohio's minority and non-minority populations. And lastly, to gain support for ongoing efforts to improve minority health year-round. Central to this mission and the message of Minority Health Month is the fact that certain groups carry a disproportionate burden with regard to the incidence, prevalence, and mortality of certain diseases and health conditions. These are commonly referred to as health disparities. Health disparities are not limited to any single disease or health condition and are both measured and monitored through the use of public health data. Most health disparities affect groups who are marginalized due to their socioeconomic status, race, ethnicity, sexual orientation, gender, disability status, geographic location, or some combination of all of these factors. Individuals in minority populations tend to have limited access to resources that many of us take for granted, such as healthy food, reliable and secure housing, a quality education, safe neighborhoods, and freedom from racism and other forms of discrimination. The purpose of this afternoon's hearing is to learn more about the illnesses and social determinants that disproportionately impact minority communities, as well as review some of the programs and services that Columbus Public Health is pursuing to fulfill its mission to address the health disparities that exist in our community. We have several guests today presenting on an array of issues that impact minority health. I will bring up our first presenter and begin the presentations. And with that, I'm going to turn it over to Mr. Ryan Johnson, the Director of Minority Health Equity in Columbus Public Health. But I also want to recognize Dr. Mashika Roberts, who is our Health Commissioner, who has joined us today. And I also saw Ms. Angela Dawson, who is the Director for the Ohio Department of Minority Health, is also in chambers this afternoon. And so, again, welcome to everyone here. I'm so glad that each of you have taken the time out to join us today. And I now am going to turn the meeting over to the Director of the Office of Minority Health Equity Section, Mr. Ryan Johnson.
Thank you so very much. On behalf of my colleagues that are here this afternoon and Dr. Mashika Roberts, Health Commissioner of Columbus Public Health, I would first like to say thank you. Thank you for the opportunity to have a conversation focused on minority health and its issues that are impacting our community. Thank you for the opportunity to discuss the wonderful work of my colleagues here at Columbus Public Health. My name is Ryan E. Johnson, and again, I'm the Program Director for the Office of Minority Health. The first part of this afternoon's agenda will center around the priorities of Columbus Public Health. Data will be presented focused on disparities, trends, and outcomes, and health equity concepts will be reviewed, and we will show how our work addresses the social determinants of health. The second part of the agenda will center around 3 multi-sector, community-based initiatives that address our health priority areas. We will share additional initiatives that support our department priorities, and we will also provide information on upcoming events open to the community, and then I'll provide a few closing remarks. So to get things started, let's just talk about good health. Good health is impacted by more than individual decisions and genetics. It involves having choices to make better decisions. It is more than just the absence of disease. It is more than just access to health care. The mission of Columbus Public Health is to protect health and improve lives in our community. CPH focuses on factors and conditions known to impact health and disease. The environment in which you live, learn, work, and play definitely impacts your health. Through customer focus, accountability, research, and equity, Columbus Public Health has a rich history of helping people live healthier and safer lives, promoting social justice, and serving the underserved. So I would say we definitely care. Listed up here, these are social determinants of health that contribute to the biggest public health challenges that we all face: an opioid epidemic, infant mortality, violence, health disparities. While these issues impact everyone in our community, some groups are disproportionately impacted and affected. The Greater Columbus Community Health Improvement Plan is the city's comprehensive cross-sector approach to addressing the community's most pressing health issues, including infant mortality, the opiate crisis, and chronic disease. The plan also includes considerations related to the social determinants of health, which are the underlying causes of health inequities. Columbus Public Health, while ensuring continued alignment with the Public Health Accreditation Board and state requirements, use the following to identify local health priorities. We use local data, which validated the need, and we'll go over the data here in a second. Community partners, stakeholders, and residents confirmed there was a community will to address these health issues, and there were existing cross-disciplinary initiatives and political momentum around these priority areas which could continue to be built on and strengthened. As we focus on the Greater Columbus health priorities that are listed up here on the slide, mental and substance abuse disorders can have a powerful effect on the health of individuals, families, and communities. According to the Center for Disease Control Prevention, chronic conditions are among the most common, costly, and preventable of all health problems. Maternal and infant health indicators are often the most sensitive predictors of a community's overall health and well-being. Together, they help tell a story about how our health and social services delivery system affect the quality of life of our most vulnerable residents. Information related to these multi-sector, community-based initiatives focused on mental health and addiction, chronic disease, and maternal and infant health will be presented after a discussion of the data that drives our work here at Columbus Public Health. So I just wanted to set the stage. If we're talking about Healthy People 2020 states that the social determinants of health are conditions in the environment in which people are born, live, learn, work, play, worship. Minority and racial groups are growing faster than the majority white population. The largest minority population is African American, sitting at about 23%. Asian and Hispanic are second largest, both at about 5%. Over 10% of residents were born outside of the U.S. Resettled refugees originate from Bhutan, Somalia, Iraq, and Burma. 1 in 8 children 5 years or older primarily speak a language other than English in the home. Our first presenter this afternoon is Michelle Grew. She is part of our Office of Epidemiology. She will focus on the data as it relates to the priorities of Columbus Public Health and the current disparities in Columbus and Franklin County. Michelle?
Thank you, Ryan. I appreciate the opportunity to share information with you this afternoon. The health priorities were selected using both a community and data-driven process. We held 2 partnership forums where we were able to gain perspective from our partners and the community at large. And in addition, we took a look at the state health improvement plan to assure alignment with that and with the goals of the state as well. We selected indicators that were meaningful, relevant, and most importantly, actionable. These helped us identify the priority health topics, and the individual indicators continue to be used to measure our progress moving forward. All of these indicators that are presented on this slide, except for adolescent depression, are included on our key community health indicators report, which is our annual update to our community health assessment. All the data is presented for Franklin County, as county-level data is typically more readily available for all indicators. In most cases, because the greater Columbus area takes up a large percentage of Franklin County, the data is similar, and Columbus often drives the Franklin County number. While most of the information and the numbers have stayed stable, one in particular continues to increase, and that's the unintentional overdose deaths, and we'll review that in a moment. Next slide, please. As Ryan mentioned, conditions in regards to access to education, housing, and employment enhance the quality of life and can have a significant impact on the population health outcomes. As demonstrated here, African American population has a higher percentage without a high school diploma, higher unemployment rate, and more live in poverty. An example of how where we live, work, and play can impact our health is the varied life expectancy within Franklin County zip codes. The life expectancy within Franklin County zip codes has a 20-year gap, where it's 61 years in one zip code and 84 years in another. Next slide, please. Mental health and substance use disorders can have a powerful impact on the health of individuals, families, and our communities. In the Franklin County, 1 in 5 adults report having been diagnosed with depressive disorder. Approximately 1 in 8 Franklin County residents report illicit drug use in the past month. And the rate of unintentional drug overdose deaths increased by 134% in a 5-year period. Next slide, please. As we all know, one of the most significant issues recently in Franklin County, as well as Ohio and the nation, is the increase in drug use and unintentional overdose deaths. The rate of unintentional overdose deaths continues to increase for all Franklin County residents. This includes non-Hispanic African Americans and whites. The rate among African Americans, though, continues to increase with cocaine-related and fentanyl-related in addition to the opiate. Next slide, please. As Ryan mentioned, chronic conditions are among our most common, costly, and preventable health problems. In Franklin County, heart disease is the leading cause of death currently. Over 60% of our population is overweight and obese. 1 in 10 adults have been diagnosed with diabetes, and almost a quarter of our population still reports currently smoking. Next slide, please. The prevalence in chronic conditions in general tends to be higher among non-Hispanic African Americans, particularly for obesity, diabetes, and high blood pressure. Though the difference between whites and non-Hispanic African Americans is not that great. However, next slide, please. When you look at the mortality numbers, the difference is a lot larger. Non-Hispanic African Americans are almost 9% higher than non-Hispanic whites for diabetes, hypertension, and chronic kidney disease. This means that though there's almost the same percentage of whites and non-Hispanic African Americans living with the disease, more non-Hispanic African Americans are dying from these chronic diseases. Next slide, please. Though multiple factors can contribute to the development of chronic conditions, including health behaviors, clinical care, socioeconomic conditions, and the physical environment, not all of these factors can be controlled, but there are several health behaviors, such as smoking and a healthy diet, that can reduce the risk of developing chronic conditions. You'll see on this slide that those individuals who are either overweight or obese or smoking or report smoking have a higher incidence of chronic conditions, suffering from chronic conditions. Smoking is the leading cause of preventable deaths in the U.S. It kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides all combined. Next slide, please. As Ryan mentioned, maternal and infant health indicators are often the most sensitive predictors of a community's overall health and well-being. In Franklin County, nearly 9% of all births were born low birth weight. Almost 11% of all Franklin County births were preterm. Our infant mortality rate is 7.7 per 100,000 births. A total of 137 infants died before reaching their first birthday in 2018. Next slide, please. Since 2000, Franklin County's non-Hispanic African-American infant mortality rate has been, on average, 2.5 times higher than that of our non-Hispanic white population. The leading causes of infant mortality include prematurity, those that are born too soon, low birth weight, those that are born too small, birth defects, unsafe sleep conditions, and maternal complications. Next slide, please. Though not listed as a specific health priority topic in our community health improvement plan, we know that violence is an issue in our community, and it spans across all three health topics. It's a serious public health problem that can impact people in all stages of life. It can erode our communities by reducing productivity, decreasing property values, and disrupting our social services. Homicide is among the top 20 causes of death in Franklin County. The number of homicides increased by 55% over the past 4 years. Between 2013 and 2015, there were over 2,600 hospitalizations due to assault. African Americans are almost 3 times more likely to be hospitalized due to assault than whites. The relationship between drugs and violence is a complex one. Drugs can impair judgment, create an inability to cope with stress and trauma, and encourage crimes due to fund addictions, to fund their addictions. Violence and the fear of violence can impact the ability to play outside, walk to school safely, or even take public transportation. Next slide, please. The overall homicide rate for Franklin County is about 30% higher than the rate for the state of Ohio. Homicide rates are higher among the non-Hispanic African-American population, with the highest homicide rates seen among non-Hispanic African-American males. Our highest, next slide, please. In addition, homicide is a geographic problem. Our highest homicide rates occur in the areas of Linden, Hilltop, and the South Side, the areas of focus for our Violent Crime Review Group. Dr. Roberts is our leader of this group, and Mr. Hicks will speak about it later. Thank you.
All right, Councilmember Tyson, if there are no questions, we'll move on to the next portion of the hearing.
No, I don't have any questions. I just, I appreciate certainly, Michelle, the information that you have just shared with us. I just had to take a moment just to take it all in. Even though we know this is happening in our community, when you certainly, hear it from your perspective, it's somewhat overwhelming. And so I am appreciative that I know that many other speakers are going to address a number of these issues as we're moving forward in the presentation. But yeah, I'm just really glad we're having the hearing so that people have a better understanding of what's happening in our community. And again, I always say, race matters. And it just does. And so, anyway, thank you very much. I appreciate that we have an Office of Epidemiology that can provide us with this information. And when we know better, we can do better. So, thank you.
While there are several ways in which the entire department is working to address health inequities in the communities that we serve, our next presenter will share specific health equity-focused initiatives that are led from within the Office of Health Equity Promotions. Malika Brewer is the director in the Office of Health Equity Promotions here at Columbus Public Health. Malika?
Thank you, Ryan. So first, I'd like to begin by giving a quick definition of health inequities and health equity. So the most widely used definition for health inequities was coined by Margaret Whitehead, and she defines health inequities as preventable and unjust differences in health status experienced by certain populations. And in this slide, you'll see that preventable and unjust being highlighted or underlined to emphasize the fact that these are not inevitable, that these are things that we can work to make changes in. Next slide, please. The goal we are trying to achieve is health equity for all. This means that every person has the opportunity to achieve optimal health regardless of their race, religion, education, sexual orientation, the neighborhood they grew up in, or so much more. Next slide, please. One of the ways that Columbus Public Health has shown its continued commitment to addressing health inequities is by having a health equity plan that is reviewed and approved by our Board of Health every 3 years. The goals and objectives that are included delineate a focused approach to the ongoing work that must be done to address health inequities. The work is monitored within the health equity section in our Neighborhood Health Division. All goals and objectives are linked to department-wide standards, which include our Public Health Accreditation Board standards, the Culturally and Linguistically Appropriate Services standards, and the Healthcare Equality Index. The Health Equity Plan priority areas include advancing organizational culture to achieve health equity, advancing and sustaining internal and community capacity to address health inequities, and influencing policy, legislation, and systems to achieve health equity. Next slide, please. The Office of Health Equity Promotion is also responsible for planning the department's annual Embracing Health Equity training series. The series is free and open to the public and provides an opportunity to engage Columbus Public Health staff and our community partners regarding health equity issues and concerns, as well as helping inform city and public partners. In 2017 and 2018, we had well over 400 training participants. In 2019, we are focused on the role of social justice in public health, where the topics are outlined on the slide here. And we are excited that next Wednesday we launch with the role of social justice in public health session. And all sessions are held at the department. Next slide, please. A new initiative in the Office of Health Equity Promotion is the Neighborhood Health Ambassador Initiative. This is an evolution of what was previously known as our Health Advisory Committees, or HACs. Our neighborhood health ambassadors are grassroots advocates that attend meetings in their community, such as area commission meetings, civic association meetings, block watch meetings, and other community-focused meetings. And they share information about Columbus public health programs, any emerging public health issues or concerns, and identify opportunities to collaborate. They are also community liaisons and trained community resources that share trusted local resources that address public health issues and concerns, and share with us any newly identified concerns within the community that we can work to address. Community volunteers that are interested in becoming ambassadors receive around 10 hours of in-person training from Columbus Public Health staff before they are officially considered neighborhood health ambassadors. There are currently 25 neighborhood health ambassadors that have completed or are in the final stages of completing their training. Next slide, please. This slide here shows the areas where our neighborhood health ambassadors are located across the city of Columbus. And I will conclude there.
Ms. Brewer, do you can individual, like groups, take this training, but they may not? So for an example, if you belong to a group and you are focused on, if you're in a service organization, and they are focused on work in any of these neighborhoods, could they become trained in this area?
Absolutely. We encourage folks that are already actively engaged in the community and through different organizations or on their own to definitely reach out to us to learn more about becoming trained to be ambassadors, because the information that we provide in our trainings are very specifically related to public health issues that they can share.
Thank you very much.
A Columbus Public Health strategic goal is to improve community collaboration to achieve health. This involves the assessment and evaluation of the effectiveness of key collaborations supporting CHIP priorities that we discussed earlier, so that opportunities for improvement may be identified and addressed. In framing the work of Columbus Public Health, we will share 3 department-led coalitions and internal committees that are addressing priorities of addiction, chronic disease, and maternal child health. Okay. Advances in public health such as immunizations, water quality, and car safety have improved the quality and length of life for people here and across the country. While we are faced with many new public health challenges, our work to protect and improve the lives is as important as it was over 175 years ago. Opiate use is now a public health crisis. In Franklin County, there's been a 581% increase in residents who died from unintentional drug overdose from 2003 to 2017, and 2 residents die each day in our community. More than 4,300 residents are active heroin users every day. Our next presenter, who is sitting next to me, is Director Andrea K. Boxell from Alcohol and Drug Services. Director Boxell is going to talk about the Columbus and Franklin County Addiction Plan.
Before Ms. Boxell speaks, can you just share those numbers again? You said 2 residents die every day, and what was the other number you gave?
Oh, sure, absolutely. So first, there's a 581% increase in residents who died from unintentional drug overdoses, and the time frame of that is year 2003 to 2017. And 2 residents die each day in our community. And then the other statistic is about 4,300 residents that are here are active heroin users every day.
Thank you. Spot.
Thank you, Councilmember Tyson. Thank you for the opportunity to speak, Ryan. First, I want to note something. Previously, this plan was titled the Franklin County Opiate Action Plan. We met with several of the subcommittees and recognized that we needed to make a change to reflect the entire community, especially including the largest city in the county, which is Columbus. In addition to that, we changed from opiate because far too often we fall for trying to address one drug versus the actual issue, which is the disease of addiction. So the title is now the Columbus and Franklin County Addiction Plan. Next slide, please. This information on this slide tells you how much naloxone is distributed throughout the community based on race. Much of the information that's presented is not new. You've been told that the majority of the runs are going for the Caucasian population. However, when you look at relative to the population, African American has the highest rate compared to that of the white when you compare it to the population. I'll give you a little more description in a second. Next slide, please. Also, when it comes to gender, the other thing, or I'm sorry, by race, this is the one. This is the one that's showing you the race of white, African American, Somali, as well as Hispanic. In speaking with our partners within the health department, especially in the Office of Neighborhood Health and Minority Health, I received an education on the importance of presenting this data across every community, not just focusing on the ethnicity and race of African American or white, in order to gain access to educating and helping with prevention activities. What we learned from looking at the data and noticing that there was an increase in African American overdose deaths relative to population, and also that with regard to gender, they're becoming a lot closer, male and female, if you can go to the next slide, is that we needed to take a different approach as to how we were reaching out to these communities. In other words, often the expectation is that someone's simply going to come in and say, I need your help. But with the disease of addiction, especially when it's still so closely tied to morality, the likelihood of that happening isn't that great. And so in the Columbus and Franklin County Addiction Plan, we met with all the subcommittees and the partners and said, what can we do? How should we do it differently? And what we've done is we've gone across systems and across agencies to say, let's come together and use offices and community centers that people feel safe and comfortable going to seek help. And that's how we came up with the Walk-In for Recovery, which will take place April 29th to May 3rd. We also ask that we not operate on banker hours, because when we do that, we make a lot of assumptions about the population we serve, including that they don't work or that they don't take care of their children. So we wanted to provide a broad time frame for them to be able to walk in for services. So it will be from 12 to 9. If you can go to the next slide, please. The other side is, instead of just trying to get a person in the door to say, you know what, I have a problem with substances and I'm seeking help, the likelihood of that is also slim to none. But if I say I'm coming in because I'm hungry, then we can feed you. I'm coming in because, you know what, even if I wanted treatment, I don't have insurance. We're working with a lot of the benefit bank providers so that they can go through the presumptive eligibility process also on site. And we worked internally within the health department because we are a really unique agency in that we're doing everything from pregnancy to birth, and all those things that come in between that are connected to health and health outcomes. So we're also going to provide STI and HIV checks, as well as Hep A vaccinations, which we know that we are in an epidemic in the state. But we're also going to say, if you are ready for treatment, we have multiple agencies located on site, and we're not going to dictate to you which treatment is best. We're going to let the assessment inform us as to where you need to go. We have 7 locations, which are located in the darker color to the right. St. Stephen's Central Community House, OSU African American Extension Program, Primary One Health Center, which is the John Maloney on Parsons Avenue, also Primary One at South High Great Southern, as well as Jordan's Crossing and Afrocentric Personal Development Shop on Livingston. All have agreed to contribute staff during those office hours, which are extreme for many, and all have offered their resources in any capacity possible. So this is what we're expecting to do with the Columbus and Franklin County Addiction Plan. It's really about breaking down those silos, bringing people together, and making sure that we're meeting the needs of the community that we serve versus just offering up services and seeing if they come. Next slide, please. If you have any further information, obviously, you can contact me here, and I do have a few of the flyers to leave with you, just so you can share it with your constituents. Thank you.
Thank you, Ms. Box. So I think it's a great initiative to have the Walk-In for Recovery and the all of the services that will be provided during that period of time, because you're absolutely right. You have to really go where people tend to be. Or they feel comfortable coming into those agencies that they typically come to. It's very difficult, I think, that when you have addiction as an illness to just decide, I need help today and I'm going to go and get treatment. It happens generally when their people are comfortable in a certain location and they can get that help where they're trusted individuals who can provide that. So I certainly appreciate the outside the box thinking of how to work with the community to provide these resources to our community.
Thank you.
Thank you so much.
Thank you.
Okay. The reduction of overweight and obesity is a strategic priority for Columbus Public Health. And it's a priority for me because my doctor said I was overweight and need to lose 15 pounds. So overweight and obesity rates are high in our community. Obesity can be a contributing factor for increased risk of many serious diseases and health conditions, which include high blood pressure, high cholesterol, type 2 diabetes, heart disease, and stroke. Autumn Trombetta with our chronic disease prevention team will provide information on some innovative work as it relates to the Chronic Disease Prevention Network.
Thank you, Ryan. And thank you, Councilmember Tyson. It's great to be here today. Next slide, please. We know that multiple factors contribute to the development of the chronic conditions of diabetes, heart disease, and obesity. These can include clinical care, socio and economic determinants, one's physical environment, and including health behaviors. So these would include physical activity in daily life, smoke-free living, and consuming a healthy diet. We know that the policies and systems that shape our environments have a direct impact on our health. And unfortunately, we see many inequities in these environments. These can include things like access and affordability of healthy food, varying barriers to physical activity, including connectivity, street lighting, and safety concerns, and also strategic predatory marketing of unhealthy products to vulnerable populations, including children and minority groups. So we know that prevention is extremely complex and will require multi-pronged approaches with multiple agencies. Next slide. So therefore, in order to prevent, we have a network of health coalitions that are working towards a united front to change our policies, systems, and environments so that all can choose to be healthy. Although we know that there are a multitude of coalitions throughout the city that are working towards healthy living, these particular groups on the slide are charged with implementing Columbus Public Health's Greater Columbus Community Health Improvement Plan that Ryan mentioned earlier. As you can see from the slide, there's a wide range of coalitions. Some are well established, some are newly formed, others are age specific, and some are neighborhood specific. The one group that works across all health behaviors for all ages is the Minority Health Advisory Committee, comprised of nearly 50 stakeholders and facilitated by Columbus Public Health Office of Minority Health. They meet 6 times a year to learn about current health initiatives and to provide feedback on the integration of chronic disease prevention services for minority population. So our next meeting is scheduled for Tuesday, May 14th at 10 a.m., and it's at Columbus Public Health on 240 Parsons. We'll be learning about how to get involved in Bike Month in May. Next slide, please. I'd like to take a moment to highlight some of the great work that the network's coalitions are working on. In regards to physical activity, we have made great strides in both infrastructure and availability of active transportation. Some highlights include our Safe Routes to School program that's implemented Girls in Gear and was also instrumental in the city's selection of sidewalk implementation around priority corridors in Columbus City School District. There's also a few neighborhood-specific coalitions that are increasing active living, including Bike Friendly Franklinton. They have provided 9 local organizations with bike racks, provide an after-school bicycle maintenance course for middle school students, and present an annual Bike Fest. And this year, mark your calendars and bring your bikes to Franklin Cycle Works on Friday, June 14th from 4:30 to 7:30. Another coalition is Active Linden, and they are assisting New Salem Baptist Church in establishing a bike loan program. And then they've also assisted St. Stephen's Community House in leading Walking Wednesdays. Next. When it comes to increasing healthy food access, Columbus City Council has been instrumental in supporting the collective effort for local food, affordable food, and healthy food. The Local Food System Strategies team is a county and city-led group that supports the implementation of the Local Food Action Plan. This team collaborates with community partners across the food system, from how your food is grown to how it gets to your table and then what happens to it when you throw it away. In 2018, Columbus City Council provided funding to the Ohio Farmers Market Network to assist in establishing the pilot of the Linden Farmers Market. This pilot season drew 4,000 customers, not only increasing food access, but also increasing economic stability for the 10 Linden-based businesses that sold product there this year. We're also grateful for the work of Growing Healthy Kids Columbus Coalition, who have been working for over a decade on increasing healthy food and physical activity options for our youngest residents, ages birth to the age of 5. So what started as a childhood obesity coalition is now a nationally recognized coalition, and they have found great success in consistent messaging across their members, including one, Water First for Thirst, if you haven't heard. Most recently, this group is bringing awareness to the targeted marketing and advertising of unhealthy products to children and minority groups. Next. And last but certainly not least, Michelle showed the impact of smoking and chronic conditions and how it kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides all combined. So needless to say, the Franklin County Tobacco-Free Collaborative has a big task at hand, and they are working on a three-pronged approach. The first is with preventing youth initiation of tobacco products, and Tobacco 21 was a great success for the whole city and county. And the collaborative was a strong supporter of that. You can see in this picture at one of our Latino community health events, we had asked young people how they felt without smoke. And many of them said strong and free and healthy, and one even went on to say that without tobacco, I will try out for the swim team. So really engaging our youth in finding healthier behaviors instead of smoking. Second approach is supporting smoke-free environments, and this includes everything from smoke-free around Baby and Me in our Celebrate One neighborhoods, and then also promoting smoke-free environments in housing, public spaces. And the third approach is finding available tobacco cessation services. Next slide. So again, not one entity can do this work alone, so we really count on our partners in order to achieve better health for all of our residents. If you'd like to find additional information on any of the groups or get involved, you can go to our website at columbus.gov, Public Health, and search chronic disease prevention.
Thank you, Autumn.
Thank you.
I appreciate the work from the chronic disease prevention, going back to the initial comments that Ryan made. And I'm appreciative of the coalition that's working together to deal with disease prevention, especially the Minority Health Advisory Council, that we need the things that you just mentioned: physical activity, eating healthy foods and vegetables, and for individuals not to begin to smoke. And that's why Tobacco 21 was so important, because we don't need to add more people smoking in our community. And so I'm glad that we did that, and I'm hopeful that for all the programming that you guys are administering, that we can get more people involved and, stop smoking. I mean, just the what it does to your system, it just, it's just so harmful, as you just mentioned. And so I'm glad that we are focused in that area to, for people to take advantage of the programs that we have to be able to live a healthier lifestyle. So thank you so much.
Thank you.
On average, 150 babies die each year before reaching their first birthday in Franklin County, and African American babies are dying at twice the rate of white babies. We are helping pregnant women and new moms stay healthy and connected to resources pre- and post-delivery through our new evidence-based home visiting program. In 2018, more Franklin County babies lived to celebrate their first birthdays, and the infant mortality rate continued to drop. But we still have a lot of work to do to make sure that all babies live. Director Tiffany Krause from our Clinical Health Division will be sharing information on the Ohio Better Birth Outcomes.
Good afternoon. The Ohio Better Birth Outcomes Collaborative is dedicated to reducing the infant mortality rate in Franklin County by improving the delivery of health care services for women and their families using quality improvement science to guide the work. OBBO has been identified as a lead partner working with Celebrate One to reduce the infant mortality rate in this community. Celebrate One is Greater Columbus's community-wide initiative to improve the health of babies with the goal to assure that all babies survive and thrive well past their first birthdays. OBBO is focused on three key initiatives: improving reproductive health, expanding access to prenatal care, and enhancing clinical quality measures to help reduce prematurity. The Women's Health and Wellness Center at Columbus Public Health focuses on improving access to quality reproductive health in an effort to promote preconception health and prevention of unintended pregnancy. Our Women's Health and Wellness Center at Columbus Public Health and OBBO share the same goals to increase the number of women initiating LARC, or long-acting reversible contraception, decrease the number of teen pregnancies, and increase the number of women safely spacing one birth with her next pregnancy. To improve the reproductive health of women in our community, our clinic provides well woman care, cancer screenings, same-day contraception, including LARC, STI screening and treatment, smoking cessation, other wellness services, and reproductive health life planning. Reproductive health and wellness services support infant mortality initiatives through promotion of safe spacing, prevention of unintended pregnancy, and support of quality preconception health. Next slide, please. OBBO consists of 4 hospital systems in the community, as well as Columbus Public Health and Primary One. Next slide, please. In 2018, the Women's Health Clinic at Columbus Public Health began providing services in the community outside the walls of 240 Parsons Avenue, with the goal to reach women in spaces they already were in the community and to improve access to the most vulnerable, including those in substance use disorder treatment, those experiencing homelessness, and those within the justice system. The following projects are part of the collaborative work that Columbus Public Health and works with OBBO. In February of 2018, Columbus Public Health and CompDrug initiated the first of its kind reproductive health clinic within a treatment center in Franklin County. Highlighted nationally, the clinic has completed over 100 visits and given 50 same-day contraception methods. This includes 25 LARC methods. Other services include well woman exams, vaccinations, and cancer screenings. Jordan's Crossing is a resource center in the Hilltop area for homeless and addicted residents, many of whom live off the land. In December of 2018, Columbus Public Health's women's health staff began providing reproductive health services there, including screenings and immunizations. Modeled after the success at CompDrug, Columbus Public Health Women's Health recently opened an on-site clinic within the Franklin County Community-Based Correctional Facility, 1 half-day per week. The response has been overwhelming, with over 30 visits and a wide variety of reproductive health and wellness services already completed. Finally, Columbus Public Health is working with OBBO and Ohio Health for women in catch court. This is a restorative justice program through the Franklin County Municipal Court. Women in catch have often been trafficked and have a substance use disorder diagnosis. Staff from Columbus Public Health and OBBO provide educational services related to anatomy, staying healthy, positive relationships. Ohio Health Wellness on Wheels links women then with same-day health care services. Columbus Public Health and OBBO continue to work collaboratively to seek out ways to improve the health and wellness of our community and to help reduce infant mortality. For further information regarding OBBO or our Women's Health Clinic at Columbus Public Health, my contact information is listed. Thank you.
Thank you, Tiffany, and just appreciate the collaborations that you just discussed and the importance of just really going to where people are and providing those resources to have better health outcomes overall. So thank you.
You're welcome.
Columbus Public Health has additional initiatives that support department priorities. Aside from enrollment services, a department program began to focus on health literacy. We have a city-led initiative creating more awareness, education, and response to trauma utilizing a network of caring providers and community members. And we're spearheading a task force that looks at crime rates and what can be done to address this disparity. The Access to Care program works to enhance and support policy and system improvements that expand access to health coverage and medical services for Columbus area residents. Our next presenter is Emily Fisher, and she'll provide some information on the Columbus Health Literacy Committee.
Thank you, Ryan and Councilmember Tyson. I'm excited to talk to you about the Columbus Health Literacy Committee. Next slide, please. The Columbus Health Literacy Committee is comprised of over 21 partner organizations working to address health literacy challenges through education and outreach. Though officially formed in 2017, this committee has evolved out of previous healthcare outreach coalitions working over the last 5 years. Understanding that engaging directly with the public doesn't always yield big results, our goal is to engage with outreach workers and partner organizations through train-the-trainer style education. We host regular presentations and encourage organizations to share more about their services through panel discussions, Q&A, lunch and learns, and facility tours. This month, in celebration of Minority Health Month, we replaced our monthly committee meeting with a panel discussion featuring 5 local healthcare clinics. This panel discussion is a great example of the types of learning that can be facilitated when committee members work together. The discussion turned out 78 attendees last week. Our goal as a committee is to bring information directly to partners who work with clients on a daily basis. We know that healthcare is a complicated system, so we look to our partners who can break down the information for their clients and their patients. We also work to provide partners with tools and resources that will help empower residents to take their healthcare into their own hands. Next slide, please. The committee developed its mission statement, formed a steering committee, and drafted operational guidelines in early 2018. And our mission is to raise awareness about the impacts of health literacy on residents, providers, and organizations, and to create easy-to-understand information to help individuals navigate their healthcare options. Beginning in 2017, the committee began a strategic doing process as a way to engage members ongoing. Each year, committee members vote on their top 3 issues that they see as challenges to Columbus residents and providers. In 2019, our 3 strategic work groups are immigrants and refugees, training and outreach, and insurance navigation. We pick 3 groups to help guide our discussions and tailor our outreach topics. During each monthly meeting, all 3 groups have time to break out and discuss what we can do together to move that topic forward. The training and outreach group was chosen to shape how we are communicating information pertaining to the other 2 groups. This allows for effective collaboration between each group. Next slide, please. So how are we measuring our success? Well, our success works twofold. First, we work with partner organizations who are subject matter experts to provide education on a variety of topics. We've done this through several different learning opportunities, like the panel discussion mentioned earlier. Since 2017, we have hosted 4, now 5, as of last week, learning sessions that have engaged over 300 individuals. Secondly, we have also developed our own educational materials to help fill the gaps and raise awareness about the impacts of low health literacy. In 2018, the committee developed a Health Literacy 101 training presentation. So far, we have hosted 8 presentations and trained over 150 individuals on health literacy basics. Next slide, please. As a committee, we are also committed to assisting with clear communication in clinic settings. Here are some examples of how we work with partners to promote clear communication during a patient's visit. In 2018, we partnered with Physicians Care Connection and our communications team at Columbus Public Health to develop a prescription guide. This guide mirrors the prescription labels that Physicians Care Connection uses in their clinics. When patients are prescribed a medication, the pharmacist will work with them to fill this guide out and go over the label to ensure that each patient understands exactly what they're taking. Because the organization relies heavily on volunteers at the clinic, PCC is in the process of training all of its volunteer pharmacists on utilizing this guide during patient visits. We are also working with PCC to incorporate Ask Me 3 into every patient visit. This is a national health literacy tool introduced by the Institute for Healthcare Improvement that empowers patients to ask 3 questions during every visit. What is my main problem? What do I need to do? And why is it important for me to do this? Since introducing this in late 2018, PCC has stated that nearly all of their patients who come into the Monday clinic that happens at Columbus Public Health are utilizing Ask Me 3 when working with their providers. We are currently working with PCC to identify the best way to capture this data and measure outcomes as it relates to improved understanding, but on its busiest evenings, PCC can see up to 40 patients a night. Next slide, please. So that's all the time that I have for today, but thank you for listening, and I'm happy to answer any questions you may have.
Thank you, Ms. Fisher. I really do appreciate this portion of the presentation. I appreciate all of it, so I don't want people to think differently. But I want to just, because it is important that people can get the knowledge that they need to move themselves forward. And health literacy is key for individuals being able to do that. And especially, I love the Ask Me 3. I have been reading a lot of materials and certainly a lot about, inequities in healthcare, and realizing that oftentimes that people don't get their questions answered, or people are intimidated by their physicians. And so, and it doesn't even matter what your economic status happens to be, but I also know that sometimes it is in regards to race that questions aren't getting answered. And so I think that having a document like this, that you're going in with, I gotta really have to go back to the slide, but what is your problem today? I can't read because it's so small on here, but to ask those questions, to be able to share what my main problem is, what do I need to do, and why is it important for me to do whatever you're asking me to do. I think that it's 3 simple questions, make it really easy for someone to share information and get information. So I thank you for helping people to have better access to health by being literate in what they're needing from their physician or sharing with their physicians or whomever they're working with in terms of their medical, the medical professionals. So thank you.
Thank you.
Our next presenter, Marion Stuckey, proudly serves the Neighborhood Social Services section at Columbus Public Health, overseeing 2 critical programs addressing both social determinants of health and community trauma. As a coalition, they're working hard to turn trauma-informed care into trauma-responsive care. Marion?
Thank you, Ryan, and thank you, Councilmember Tyson. I am always thankful to have the opportunity to share more about the Columbus Care Coalition. The Columbus Care Coalition believes in the power of engagement across the continuum in order to provide residents with the best services. This includes building strong partnerships with organizations and residents. With strong partnerships, we can build appropriate referral networks, gain full insight on the community and their concerns and perspectives, and work together to build resiliency. While trauma is prevalent, so is resilience, and each of us has a great propensity to be resilient despite our circumstances. Through engagement and active supportive services, we seek to help Columbus become a trauma-informed city and also a trauma-responsive city, especially through a shared belief that we are connected in the experience of trauma and we can show our care and concern and humanity for others through our interactions. Next slide, please. This image shows the transition of communities in trauma, the care intervention, and the subsequent resiliency that can be built in communities. When a community has experienced trauma, we can expect to see isolation, hopelessness, and numbness. A collective grieving process ensues, and there's very little hope for change, and that's reflected by statements such as, "This always happens here." Over the past couple years, CARE has crafted community-driven and sensitive responses, including crisis response, outreach, training, and community-based committee meetings. Our goal is community healing and empowerment to make positive change, which is a term called collective efficacy. Next slide, please. The work of CARE is enriched with partners that continue to be a major contributor to the work. CARE has a great network with a variety of stakeholders. Right now, we have over 300 partners that are connected to our work, and this includes mental health providers, community organizations, and city government. Next slide, please. For the 2017 and 2018 year, CARE completed a pilot period in Linden and Hilltop. We are pleased to have great outcomes from our pilot, including completing a number of special programs for faith leaders, students, residents through listening sessions, faith leader summits, mental wellness events, extensive community outreach, and many other activities. CARE's strategy for meeting the community where they are and bringing our services to them has helped and happened through extensive door-to-door outreach, which happens post-crisis, and through general outreach. CARE had our first annual Remembrance Vigil in 2018, and we just had our second one on April 10th, which also is National Victims of Crime Rights Week. Each month, CARE provides trainings in the community on trauma responsiveness. To date, we've reached over 700 individuals, sharing resilience factors and creating better understanding of emotional trauma. And finally, through generous support from both CPH and City Council, CARE has gained additional staff to carry out the work. Next slide, please. The CARE Coalition provides training, outreach, networking events, connection with resources, and crisis intervention. And as I mentioned, we've been piloting in Hilltop and Linden, and we'll now be moving to the South Side as well. Next slide, please. Here are ways to connect with the CARE Coalition. We have a phone line, a web page, as well as a Facebook page. Next slide, please. And I'd be happy to take any questions.
Marion, can you, if you go back to your slide towards community resilience, and I know that Eunice mentioned communities in trauma, isolated, hopelessness, numbness, et cetera, but I also think it's important to speak to the issues that are going on in that community, gun violence, domestic violence, and other forms of trauma. Because that, I mean, again, I want to make sure we're connecting that on the part, this hearing this afternoon, there's some areas that we're certainly focused on that we said are key. And those happen to be, you know, infant mortality. So we're hearing a lot about infant mortality, and certainly there's a lot more that we're doing than we're just saying in this hearing this evening, this afternoon. And then, of course, chronic disease, but also we're having the discussion about, you know, violence, the gun violence in the community. And so the work that you're doing and the incidence of gun violence, how it's continuing to increase, and it's increasing and generally going up in the minority communities, that your work is in these communities to try to make sure that when that violence is occurring, that when it has occurred, that you are working in those communities to deal with the trauma of that violence in the communities and providing ongoing resources and working with other groups of people so that the violence does not, you know, if someone has been killed or hurt, that someone else is not retaliatory, that you're trying to look at how to prevent any more violence from going on. And I think that's important. I mean, I know you kind of just moved through, I know you guys are moving through these slides, but I certainly want our viewing and listening audience to be able to see the connections between what you're saying your main goals are, and this is all about what you're doing as an organization to educate, provide resources to make sure that we don't continue to have these disparities. And to also, part of this is about education, to people to understand what's really going on in the community and why we need to have these resources that each of you are discussing today, these resources in our community to help our community to be able to remove these inequities and to move our community forward. So I just wanted to make sure I'm saying that about especially this particular issue. Thank you.
Mm-hmm. Thank you.
Public health played a major role in eradicating diseases like smallpox that stole the lives of people young and old alike. Today, another major public health issue is robbing people of their lives, but in a different way. And that's evident with the recent passing of entrepreneur, father, and artist Nipsey Hussle. In 2017, Columbus saw a record number of 143 homicides. Gun violence is a public health issue, and we are addressing it in the same way we have addressed other public health challenges throughout history. Our next presenter is Richard Hicks from our Violent Crime Review Group, and he's going to share with you information on the Violent Crime Review Group.
Thank you, Ryan. And thank you, Councilmember Tyson, for the opportunity to come here today to share information about the Violent Crime Review Group, or the VCRG, as part of our department's efforts around minority health. The VCRG deals specifically with homicide, and homicide's obviously not an issue that affects only minority populations, but they are disproportionately impacted. In 2018, for example, Columbus had 102 homicides. 75% of both the victims and the suspects were African American, in a city where the African American population is about 23%. So We hope our work, while helping everyone, can help eliminate this disparity and strengthen impacted communities. Next slide, please. The VCRG was one of a number of initiatives that was formed in 2017 to address a spike in city homicides when we had 143, as Ryan mentioned. But it's also an effort to work in a different way than what we've done in the past around this issue. Instead of looking at it as simply a criminal justice issue, we're trying now to look at homicide through a public health lens, to work comprehensively with multiple agency partners, to focus on the systematic collection and analysis of data around homicides, to identify trends and risk factors that may be connected with these killings, and hopefully to use all of this to make better recommendations and strategies so that we can reduce homicides in the future. The VCRG consists of representatives from 8 city departments and agencies. Those are Columbus Public Health, the CARE Coalition, Columbus Police, Safety Administration, the Department of Neighborhoods, Department of Development, Recreation and Parks, and the Mayor's Office. And there are 2 main elements to our work. One is that we want to have a rapid response to homicides when they occur, and the other is that we want to develop and use a comprehensive homicide review process. The rapid response piece of this was developed in 2018 with the formation of a homicide notification system, or HNS. The HNS was established in 3 pilot areas of Columbus to do 3 things, really: to immediately notify key city agencies when a homicide occurs, to convene representatives from those agencies in a collective call so that we can all learn about the details connected to the homicide at once and at the same time, and to develop a response plan and get resources into those affected areas as soon as possible. The HNS areas were based on police precincts. These police precincts were based on historic levels of homicides that have occurred in the city over time, but also on existing city resources and infrastructure that we've put into these areas and that we want to try to use to leverage our work. The first HNS area was in Linden and was established in May of last year, followed by the Hilltop in August and the South Side in October. And you can see the areas on the map at the right there. So between May of last year, when the HNS was established, and December, we had 19 homicide activations for 20 homicide victims. This year, as of March 13th, when this slide was created, we had 10 activations for 10 homicides in the 3 notification areas. You can see in this slide a breakdown of some of the associated information connected with those homicides, information on the neighborhoods where they occurred, the victim gender, victim race, assault type, and the age range of the victims. Since March 13th, again, when this slide was created, we've had 4 additional homicides in addition to what you see here. Next slide, please. As I mentioned earlier, the goal of this rapid response system is to get applicable city services and resources into affected areas as soon as possible. These services center around providing grief and trauma resources for victims' families, friends, and concerned residents, and also assessing and improving neighborhood conditions where these homicides occur. And here we're talking about things like street lighting, the conditions of the surrounding neighborhood, the conditions of the residential properties in the area, and the alleyways as well. This slide shows a breakdown of what our HNS partners have been able to do since the system was established last year. And again, the information here is as of March 13th of this year. Next slide, please. So the other piece of our work, as I mentioned earlier, is to develop a homicide case review process where we can systematically look at the facts around all of the homicides that occur to try to identify any common trends or any common factors to hopefully make better recommendations around homicide reduction. And this piece has been a little bit more of a challenge, which generally has revolved around the idea of information. Information on current cases, which are the most useful, I think, to use, may be limited, either because police may not have all the information or because there might be concerns about sharing it with others. On the other hand, if we look at closed cases, which have the more complete information, these may be 3 to 5 years old. So looking at closed case information, we may not find the same factors and same things going on in a homicide that may be occurring in our community right now. So that's one of the areas that we're trying to address. Right now, the VCRG is made up only of city agencies. So in some cases, we don't have the actors or the information on some of the contextual information about homicides, things like a person's employment history, their education history or social service history. And these are all other things that may be very important in helping us better understand the circumstances around the homicides, its victims, and its perpetrators. So we've got some hurdles to kind of work around, and we're exploring new avenues and new initiatives to work around some of these barriers. In the case of information, we're currently working with the Franklin County Common Pleas Court to gain access to pre-sentence investigation reports on folks that have come through their system. The court may have collected information on people that would help us in terms of their social service history, their educational history, things like that, especially if some of the folks in those court systems have ended up being perpetrators of homicide down the line. As far as some of the informational needs that we have, we're also exploring the idea of bringing in new organizations and forming what we would call an auxiliary VCRG, where agencies could be invited to share with information about social service history, educational info, vocational history, and things like that. The note here about social networks and gun violence concerns some innovative research that we're interested in exploring around arrest data that can help identify and map the networks of individual people that are connected to gun violence in communities. So we're moving ahead with plans there. And finally, we're also working with Grant Medical Center personnel right now in developing a violence reduction pilot program. So next slide, please. So as far as where things stand right now, I've mentioned the Franklin County Court and the PSI reports. We're making arrangements with the court right now, and we hope to have those completed later this summer, where we can go in and actually start to review some of those reports. As far as the auxiliary VCRG, we're discussing formation in that group currently, and we hope to be able to approach some key agencies about joining an auxiliary VCRG with us later this year. The draft research contract that I mentioned, or I will mention, with the Social Network and Gun Violence Initiative, we've drafted a contract with a Northwestern University faculty member to map our social networks around gun violence, and we hope to have that signed shortly. And we've been working with Grant for the last 2 or 3 months now and to try to lay the groundwork for a violence reduction pilot with the hospital there. And we hope to be able to have a concept paper completed on that later this week. So after establishing our rapid response network last year and laying some groundwork this year on homicide case review, we think we're poised to have some major steps and to move some things forward in the last half of this year. So with that, I'd be happy to try and answer any questions.
Thank you, Mr. Hicks. Can you share with me just kind of what the proposal would be that you're looking at with Grant Medical Center for their violence reduction effort?
I think my elevator speech would be that we want to try to use patients that have come into their trauma care center and offer them, if they've been there in connection with a violent episode, we would like to offer them a linkage to community services and organizations that can give them skills to build a ramp away from violence. So what we would want to try to do would be to have community folks that could work with us if people want to take advantage of it, guide those people through some of the things that they could benefit from in terms of some of those skills, and have that process go for a period of months or a year, and compare the recidivism that we would see after having some of those outreach initiatives or working with those agencies, compare that group of people with folks that decline to enter that program, and then compare at the end of a year to the people that get the services. Are they involved in repeat violent incidents? Are they involved in repeat arrests? Or have we noticed a change there in comparison to the group that elects not to get connected with our program and those services.
Thank you. I just really do appreciate the outside-the-box thinking, and I'm going to try to provide, I can provide it to you or Dr. Roberts. I was, I think it was a year or so ago, I was at a session at Yale University, and they had one of the physicians there. He was I don't know if he was an emergency room physician, but I know that he and some other physicians worked together. I think even created, they maybe even created a nonprofit outside of through this hospital system based upon seeing so many individuals keep coming into the hospital for either, for the, gun violence, and so they came up with a program to address this issue. And I'll try to get the individual's name and provide it to you just to give you some additional information as you're doing your work.
Thank you.
And interesting, because it's hard to go looking at all these different areas, but when going back and forth on these pages, but certainly, as you know, how the social determinants of health are just all through this entire presentation. And when you think about the neighborhoods where you're having violent crime, these are neighborhoods that, and I would have the your mortality at probably 60 years, or it's all coordinated, and at some point, and I'm sure you guys have all this data, it'd be interesting just to kind of see, who these people are, where they live, what their education has been, the amount of resources that have been provided to their families. I mean, you could almost track individuals having certain issues just based upon, as you know, the social determinants of health. And I think we have to start showing stories of here's what's going on in people's lives. Because when you can provide lots of information, how do we make it so people can easily grasp that this is why this is happening?
Well, and as you say, in the case of homicide, there's more to it than just looking at it from a criminal justice lens. It gets back to what you're saying. There's so many other factors that probably influence outcomes as far as crime and homicide, in addition to just straight criminal justice type of have they been arrested or not, or how many times. So I agree.
Yeah, I mean, in all the areas, yes, it is. I mean, it's race, and it is the social determinants of health. I mean, we're having hearings on minority health, and the disparities, and that's race and ethnicity. That's where you start. And then you look at the other areas. I mean, you look at the social determinants of health with that. There's clearly a picture here that, the picture is clear of what we're talking about in terms of all the areas that we're discussing today. And we have to be able to say race matters. Race is an issue. And so, but again, I have so much respect for the work that each of you do every single day. Every single day. Because you're out here trying to make life better for everyone. And I'm appreciative that you're also bringing other resources in. I think clearly we have to educate more people on what is going on in our community. These things just didn't happen that one day I'm just going to decide to go pick up a gun and go shoot somebody. There is a story, or one day I just decided I'm going to use drugs, or one day I'm just decided that, it doesn't work that way. So we have to begin to tell the whole story. So again, I don't want to go my soapbox because this is just near and dear to me. That's why I'm have these hearings, and so I appreciate your presentation. Like I said, I just have so much respect for each and every one of you, and I also have to say that Dr. Roberts, under your leadership, you're thinking outside the box, looking at new ways of sharing information and trying to help move our community forward. And I really appreciate that. So thank you.
The Office of Minority Health here at Columbus Public Health has an important responsibility on leading efforts to educate citizens and professionals on imperative health care issues. Before I provide closing remarks, I wanted to have two of my colleagues take a brief moment and share opportunities that are still available for the community to take part of as it relates to Minority Health Month. Hibo Noir, representing the Office of Minority Health, is going to provide information about Minority Health Month and initiatives that are coming up at the end of April. Hibo?
Thank you, Ryan. Celebrating Minority Health Month, Dr. Booker T. Washington dispatched a letter to the leading African-American newspaper in April of 1915, arguing that, I'm quoting this one, health was the key to progress and equity in all other things, that without health and a long life, all else falls. Minority Health Month encompassed a 30-day campaign of activity designed to solicit the interest and participation of minority or provide health service to the minority population. Minority Health Month is now set in April by U.S. Department of Health and Human Services. Next slide, please. In 1989, the Ohio Commission of Minority Health established the concept of a month-long campaign to increase the health awareness and disease prevention among minority residents. The 5 goals of Minority Health Month are to provide crucial information to allow individuals to practice disease prevention, promote health lifestyles, showcase resources for healthcare and information, highlight disparate health conditions between Ohioans minority and non-minority population, and gain additional support for an ongoing effort to improve minority health year-round. Next slide, please. These initiatives listed above are some of the partnership the Office of Minority Health has with other programs, with the department, and with the community partner. They all help play a role in addressing the disparity impacting our residents. These are just few of the events we are doing on Minority Health Month. So some of them, they already are taking place, but the last 3, they are the one who are happening. One is April 24th, which will be CABA Community Forum in Health and Wellness Activity that will focus on addiction and its impact in African American community. The 27th, that's a CABA one. And April 24th is Embracing Health Equity Training Series will kick off with a discussion on a role of social justice in achieving health equity. The final one will be the one our office coordinates, specifically myself, I coordinate this one, is April 27th. This will be the 8th annual Somali Health Fair. This specific event we designed to do for Somali community, but it's open to all. The reason we create this one is not only for the community or minority population to have resources and information. Also, we create this one, the providers and the social services, to have a chance to engage the community, which is different from them, and build the relationship and the trust. So in this event, I invited like 4 Somali doctors to participate, 2 Somali dentists also will participate, and 4 Somali nurses and 1 Somali pharmacist. So the reason we invited the Somali doctors and the pharmacists and the dentists is to help their community, and the community, as we talk all about now, the disparity and the language barrier is a problem. So we want a community to be kind of happy when they see their providers or healthcare providers. Also, I encourage the Somali student to participate in this one. So 30 plus Somali high schools and colleges also, they volunteer in this event. So last year alone, close to 1,000 residents are impacted in one of Minority Health Month initiatives. Thank you.
Thank you, and certainly thank you for your outreach in the Somali community, and so that individuals who to come there and be also engaged with individuals that are just not like them. And I just appreciate your leadership in that regard. Thank you.
Sorry, I had to turn on the mic. Also representing the Office of Minority Health, Jesus Avalle is going to provide information about billboards throughout the city that are strategically placed and other initiatives that are occurring after Minority Health Month in 2018. Jesus?
Thank you, Ryan, and thank you, Councilmember Tyson. For a complete calendar of Columbus Public Health minority health activities and partnership listings, which include times and locations of events that are occurring, please visit our website or contact 311. Other activities that we're conducting throughout Minority Health Month include working with our strategic nursing team. They are providing blood pressure and blood sugar screenings throughout the community, as well as at Columbus Public Health. We are strategically planning with the advisory committee to coordinate activities and initiatives throughout the year. And we are also doing cultural humility trainings out in the community. As Ryan mentioned, we have various billboards set throughout the city. These billboards have been strategically placed in 6 locations in Columbus, promoting Minority Health Month. What you're seeing here is the actual billboard that we have for the Minority Health Month campaign. And they are located in the following target areas: Georgesville and Lincoln Park, Green Lawn and Front, Cleveland and Clarendon, West Broad and Wilson, Morse and Westerville, and East Main and James. Our outreach to the LGBTQ community is important because of the many disparities the community faces, including higher rates of depression, HIV and STIs, tobacco use, homelessness, and drug and alcohol use. The Office of Minority Health now has a dedicated staff member for the LGBTQ community who does outreach to the community, conducts health cultural competency trainings, plans our work at Pride festivities each year, and heads up our LGBTQ Health Coalition. This year, again, we'll be participating in the Pride Parade and Festival on June 15th, and we invite all of you to march with us and be part of our wellness booth at the festival. We are also excited to announce the upcoming Diversity and Health Equity Summit being held on July 13th. This is a collaboration with Columbus Public Health Health Equity Section, OSU Wexner Medical Center, the Columbus NAACP, and community volunteers. It is an all-day event that is free and open to community members. The objectives of this summit is to provide a health-related event to educate and empower the Columbus community. The 3 workshop tracks include prevention and wellness, which focus on healthy behaviors and choices, including nutrition and fitness, advocacy, how to advocate for a change in your community, and health equity, which focuses on diversity, cultural competence in healthcare, and social determinants of health.
So a health disparity is defined as preventable differences in disease, injury, violence, or opportunities to achieve optimal health that are experienced by disadvantaged populations. Health disparities often affect people of color, those who are poor, those who have certain behaviors and/or health risks. All people deserve a fair chance to lead a healthy life. During our time this afternoon, we have highlighted coalitions as we work across the city in addressing disparities. We have showed how department-led coalitions and internal committees are addressing the priorities of Columbus Public Health. We have shared additional initiatives supporting the work addressing the social determinants of health. I would like to thank you, Councilmember Tyson, for providing Columbus Public Health the opportunity to discuss these issues that are impacting our community. Hosting minority health forums such as this gives our stakeholders and listening audience an opportunity to learn about imperative healthcare issues. For more information about Columbus Public Health, the work of the Office of Minority Health, or any of the upcoming initiatives that we just shared with you, please contact me, Ryan E. Johnson. My number is 614-645-7335, or you can reach me via email at rejohnson@columbus.gov. Thank you so much.
Thank you, Ryan. And before I conclude the hearing and make some additional comments, we do have one speaker here, and it's Mr. Dwayne Stewart. And please state your name and who you represent. Good afternoon.
Good afternoon. Hello, Councilmember Tyson. Thank you for convening this hearing today. My name is Dwayne Stewart. I am the Director of Prevention at Equities Health, and I'm here with my colleague, our Policy Manager, Katie Shanahan, and we are here to basically reiterate the importance of focusing on LGBTQ healthcare during this important Minority Health Month, especially within LGBTQ communities of color. On behalf of Equities Health, I'd like to first thank the Council for its longstanding support for our organization and for the integral partnerships we have with the City, including the City Council, the Mayor's Office, and Columbus Public Health. Our collaborative efforts make it possible for us to provide essential health care and supportive services to our patients and clients. The support we receive from the City is critical to our success and the health and well-being of our neighbors. We appreciate the opportunity to speak specifically about health disparities for those at risk or affected by HIV and the broader LGBTQ community experience. Due to systemic inequities and injustices, members of the LGBTQ+ community are disproportionately affected by physical and mental health illnesses. They are less likely to have health insurance, and they experience worse health outcomes compared to the general population. Additionally, despite being a population with pronounced healthcare needs, LGBTQ+ individuals face a lack of culturally humble and structurally competent providers. Health disparities for transgender people are among the highest. Stigma, discrimination, and exclusion prevent transgender people from fully participating in society, including accessing health care. These factors, when combined with racism and transphobia, disproportionately affect the health and well-being of transgender people. The HIV epidemic also lies at the intersection of a number of structural inequities. You may know that the Ohio Department of Health reported in 2017 that Franklin County had the second highest new infection rate, which is nearly 20% of all infections for the state are here. The population subgroups within HIV, most at risk for HIV in Ohio, include racial and ethnic minorities, members of the LGBTQ+ community, and people who inject drugs and sex workers. Members of these population subgroups are more likely to face discrimination and stigma in various facets of their life, not least of which is in their ability to access affordable and equitable health care. They too are more likely to live in poverty, to face food and housing insecurity, and to face health disparities. These negative experiences directly correlate to poor retention and adherence to care, resulting, again, in many health disparities. These compounding social, societal, and economic factors also result in a higher rate of HIV transmission. But it's not just about higher HIV rates. Ohio's HIV criminalization statutes are disproportionately enforced among these same subpopulations, groups whose members live in communities that are often facing overpolicing. This leads to these population subgroups being overrepresented in our criminal justice system and being even less able to access necessary health care, support services, and safety net programs. In order to best address and ultimately reverse the health disparities that people at risk for or are affected by HIV and the members of the LGBTQ+ community, we must work to ensure equitable access to affordable and non-discriminatory health care and to the essential safety net programs that link people to support they need to lead healthy and stable lives. Equities Health appreciates the city's leadership in reducing health disparities, and we remain committed to partnering to effect positive change for our most underserved communities. Thank you.
Thank you, Mr. Stewart, for certainly coming down and providing those remarks to us. I know that we appreciate the relationship that the city has with Equitas Health. I also know that we appreciate the relationship you also have with Columbus Public Health, and that the issues that the presenters were sharing today absolutely are issues that you certainly discussed tonight, this afternoon. and affordable health, affordable, not just affordable health care, because we definitely need affordable health care. We need people to have access to health care. And so an organization like yours, certainly helps to meet the needs of the individuals that you shared, but our entire community should make sure that we are a community that's open to everyone and caring for everyone. And so we want to continue to work with you to make sure that we're providing the best care for every individual in our community. So we look to you and your organization to help us to be able to do that. I'm sure that Columbus Public Health would also, as they've had relationships with you, will continue to want to do that. So I just appreciate you coming and sharing the information from the population that you're serving so well, and to bring it to not only my attention, but to the attention of the Columbus residents, that we all need to come together to remove these disparities so that everyone can live their best quality of life. And the only way you do that is to be able to have the best health care. So thank you for being here. And again, we appreciate being a partner with you.
Yeah, thank you for having us.
Thank you. I hope our viewing audience has benefited from the information that was shared this afternoon. The state of minority health and the challenges. Actually, before I say that, I don't know, Director, do you have any comments you'd like to make, Ms. Dawson? No, you're good. Before I stop, okay. Thank you. Okay. I hope our viewing audience has benefited from the information that we have shared this afternoon. The state of minority health and the challenges with the opioid epidemic, violence, and the health disparities. I'm going to go back from the opioid epidemic, just dealing with not just opioids, but addiction illness. Let's just say that. Violence and the health disparities demonstrates that we need entities such as Columbus Public Health working in conjunction with community partners to address these issues. In addition, efforts must continue if we're going to eliminate the disparities of Black mothers and babies faced with infant mortality and maternal mortality. Yesterday was the conclusion of Black Maternal Health Week, an effort to drive institutional and policy change to support the health of our Black mothers. As I continue my work with the Commission on Black Girls, an initiative I created last year, we hope to learn more to proactively address the reproductive health of our Black girls. Further, we have to continue with presentations and conversations such as the one we're having today. This allows us to make people aware of the services that are available in our community. Before I conclude, I'd like to thank each of our presenters. I want to first acknowledge Ryan Johnson, Director of the Office of Minority Health, for all the hard work he put into this presentation, as well as coordinating speakers for today's hearing. All the presenters, I want to just say thank you for the work that you're doing. You play a critical, important role in our health disparities, addressing health disparities. I not only appreciate the work that you're doing, but also you provide invaluable information to policymakers about what the needs are and how we can enhance services to our residents. So I want to thank Michelle, I'm going to say your last name, Michelle Grew from the Office of Epidemiology, Malika Brewer, the Office of Equity Promotion, Andrew Boxell, I'm so glad you've joined us, from Columbus and Franklin County Addiction Plan, Autumn Trombetta from the Chronic Disease Prevention, who works so closely with Cheryl and Jaleesa from the Food Plan, but thank you for your leadership. Tiffany Cross, the Clinical Health Division, Ohio Better Birth Outcomes. Emily Fisher, Access to Health from Columbus Health Literacy Committee. Marion Stuckey, Neighborhood Health Social Services. Richard Hicks, Violent Crime Review Group. Jesus Ovali, did I say that right? From the Office, Latino Liaison from the Office of Minority Health, and Hibo Noor, the Somali Liaison from the Office of Minority Health. And I also want to thank individuals here who are from Columbus Public Health. Mike, thank you for being here in Chambers this evening. I just so appreciate what you do. I just so appreciate you. I also have to thank the professionals at CTV who work hard to prepare for these hearings and broadcast these hearings. My team, Nicole Harper and Carl Williams, Christopher Maitland, who is here, our Legislative Research Office team member who supports Health and Human Services, and then also my council members and their staffs. And lastly, most of all, I have to thank the residents of Columbus who allow us to do this work each and every day. It really is an honor and privilege to work in the office that I work in, but it certainly is an honor and privilege to be an employee of the City of Columbus and to be able to serve our residents. And so again, with that, thank you. I want to say have a happy holiday, Easter, Resurrection Sunday, Passover. Just really thank you for being here and have an enjoyable rest of your week and weekend. Thank you.